So based off of his history, it indicates to us that she doesn't have a fracture. And so there are a couple tests that we can do, which is a squeeze test, tuning fork, or the flicking test. So I'm gonna be doing the squeeze test just in case. I'll be squeezing the acromioclavicular or pressing down onto it. So how I should feel like downward pressure. Usually I would start medial or distal away from the injury and work myself towards the injury. Any pain?
A little bit.
Then next I'll check the posterior side over scapula, like the spinal area of the scap, and I'll check medial to inferior angle and palpate from the lateral angle back to her acromion. Any pain? As of right now, I don't feel any divots or false movement towards her bone. So what we'll be doing now is doing some manual muscle testing. Okay, so the test that we'll be doing is a manual muscle test. For the shoulders, we'll be checking for shoulder flexion. The muscles that are applied towards shoulder flexion is the anterior deltoid, your coracobrachialis, and your supraspinatus. So, Mr. Moore, what I want to do is raise your shoulder up to 90 degrees in shoulder flexion, and I'm going to add resistance going down. What I want to do is try to resist me putting your hand down, okay? And if you feel pain, let me know. So what I want to do is stabilize the shoulder, and then put a downward force on her distal end of her humerus, okay? Okay, I want you to resist. Any pain?
A little bit.
Okay. So it's positive for pain around her rotator cuffs. And it can be her supraspinatus, which is indicative of that, which is she found pain around shoulder flexion. So the first test that we'll be doing is checking the acromioclavicular aspect. So we'll be doing a joint play. So what we're going to be doing is Abigail or Ryan is that I'm going to be pulling your acromioclavicular that's located in the distal end region. I'm going to be pulling it up, down, back, pushing it back, and pulling it forward. Is that okay? And so when I do this, I want you to tell me if you feel any sharp pain or pain in general. Okay?
Mm-hmm.
So palpate, check, palpate from medial to lateral, checking for any deformity, point tenderness. She had point tenderness on the anterior aspect, and so what I want to do is check her acromioclavicular. Okay. Ready? So I'll be pulling it up. Any pain?
A little bit.
I'm gonna be pushing it down. Any pain? I'm gonna be pushing it posteriorly. Any pain?
Mm-hmm.
And I'm pulling it towards me. Any pain?
A little bit.
Okay. So as right now, she seems to have pain as I pull up and as I pull anteriorly. And so the next test that I'll be checking is doing a glenohumeral joint play. And that I'll be checking the anterior aspect of it. So as of right now, we're going to be checking her glenohumeral. We're going to be doing an anterior joint stress test. So what I'm going to have the patient do is have her arm abducted to shoulder abduction at 90 degrees with an external rotation. Me as the clinician, I'm going to place my hand on the anterior aspect of the shoulder, stabilizing it and pulling on her humerus and or superior going up. Checking if she has any pain towards that area. So Ryan, what we'll have you do is have your shoulder abducted 90 degrees, externally rotated. Okay, so I'm gonna be pulling from the mid shaft and stabilize the shoulder. Ready? Tell me if you feel type of pain. Okay. So it comes out to be positive that she has pain on the anterior aspect, which it shows indicative of laxity of her cord humeral. The next special test, or the last special test that we'll be doing, is the Hawkins-Kennedy test. So we'll be checking for any damage towards the supraspinatus tendon. So what we're going to have her do is raise her shoulder into shoulder flexion with elbow flexion at 90 degrees, and I'm gonna add resistance doing internal rotation. Usually with someone who has that, is indicated positive for a supraspinatus tendon injury. So, Mr. Moore, can you do what I just said? Shoulder flexion, elbow flexion at 90 degrees. I'm gonna internally rotate your hand. Okay. Okay. Did you feel any pain, or tingling, or sharp pain? So after assessing Ryan Moore's injury, I believe that the diagnosis that Ryan Moore has is a subacromial impingement, which is caused from having an impingement of the supraspinatus tendon. And so this usually, usually has signs and symptoms of point tenderness upon the acromion, decrease of internal rotation of the shoulder, increase of external rotation of the shoulder, pain, increases with overhead, and so which indicates it could be a subacromial impingement. To rule it out, or to have a differential, could be muscle weakness upon the supraspinatus, anterior deltoid, or your coracobrachialis. It can be your differentials. What we want to do now is make sure to refer to a physician to rule out any possibilities and to get a MRI check. And so for our treatment plan, what we can do is to increase the strength or work on the rotator cuff, increase motion, range of motion, and work on his lower and middle trapezius fibers as well. Thank you. Let me see if you